This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue as
Enter the
opposed to
second.
health first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario and you are watching Medical Dilemma. Influences, mainly those coming from Western cultures, have radically changed local values and lifestyles, especially among teenagers. Thus, the issue of teenage pregnancy has taken center stage. Various sectors of society continue to debate for and against what to do to address this, but lives are being lost as I speak because of mainly of a lack of understanding of health risks and complications. For this episode, we will examine the medical and ethical issues that are connected to pregnancy among teenagers. Now, joining me for the first segment is Dr. Elizabeth Ifurung Gonzalez, obstetrician and gynecologist, former president of the Makati Medical Society, and cum laude graduate of Biochemistry, University of Santo Tomas. Welcome to the show, Dr. Ifurung.
Thank you, Sir Sunny and Dr. Sanchez for inviting me in your show.
Okay, Dr. Ifurung, for the benefit of our viewers, let's have a short discussion of certain concepts and principles that are connected to pregnancy in general and teenage pregnancy specifically. First of all, now that we have a topic about teenage pregnancy, it comes to my mind as if it's a special issue. So are there differences between pregnancy in teenagers and pregnancy in maybe what we would call mature females?
Oh yes, there is because among teenagers, they have not fully developed yet, physically and emotionally. So that's the big difference from that of the adult.
So for example, if we take a look at the physical aspect, as you mentioned,
Yeah.
Teenagers are not yet fully
Developed, yeah,
So in other
especially skeletal-wise, like the
skeletal-wise.
yeah, the pelvic bones are not yet well developed. So sometimes they will experience complications during delivery.
You made mention of the pelvic cavity. I guess this is the space
For the baby,
in the
for the
pelvic
uterus is
area where the baby goes through.
yeah, will pass through.
So does it mean that the cavity is too small to allow for a normal
Yes,
baby
sometimes because they're
delivery?
still young. So physically, even if their bones are not yet well developed, so that happens.
That happens. I see. Aside from the cavity difference, is there any other physical difference? Like, for example, the development of the ovaries or the fallopian tubes or the uterus?
Yeah, actually, that's usually in young women, their brain is not yet well developed, which is the one concerned with the hormones stimulating the development of the eggs in the ovaries.
Okay.
That
So
one.
the eggs are not yet fully developed.
Now,
in the,
the mere fact that they got pregnant is their eggs have been fully developed, but the brain that controls the hormones is not yet mature. That's what
I see,
yeah,
I see.
That's not yet mature.
so I guess there is an emotional or psychological difference between a teenage mother and a
Yes, because
fully mature mother.
yeah, that's correct.
Okay. In your experience, what are these emotional differences that you have observed?
I have few patients who are who have been pregnant at the age as teenagers. Emotionally, they are not really mature yet because they lack education, and they really need the support of their parents. And luckily for my patients, the mother is usually with them, and if you don't insist on them or regarding the importance of having prenatal checkups, they usually don't go to you. So meaning to say, they're not yet really ready for that pregnancy.
Okay,
because
so correct me
it's
if
just
I'm
an
wrong. So
accident.
what you're saying is very, very young mothers are not fully prepared to both take care of themselves and their coming baby.
Yes, that's
I see, and that leads to certain complications during the pregnancy. Okay, now considering that there are such differences, what are the possible risks and complications that could arise in a teenage pregnancy?
among teenage pregnancies, they have higher mortality and neonatal rates. Like in a study, it was mentioned that teenage pregnancies below 16 years old, they have 4 times risk of dying compared to adult.
Below 16 years old.
And it's really the young maternal age. That's the reason. Then other things, they are more prone to complications like their babies are usually low birth weights because of intrauterine fetal growth restriction.
Okay.
They have a higher risk of developing hypertension, and they also have anemia. In the first place, they're already anemic, and then if they get pregnant, the more they become anemic, they have the tendency to deliver prematurely also.
I see. So the low birth rate, as you mentioned, is
Yes.
actually a result of sort of something like the uterus being too small?
No. Usually the baby has poor growth.
Poor growth.
Yeah, poor growth.
And this is caused by what factors?
Probably during the pregnancy, if they don't follow the instructions of the doctors that they have to have a balanced diet, they have to have supplements. The doctor will usually give them prenatal vitamins during pregnancy, and that includes multivitamins, iron, the micronutrients, iodine, calcium, like that.
Doctora, I'm curious, what is the youngest age at which a female can get pregnant?
Actually, as long as they already ovulated, there's a tendency for them to get pregnant, and usually that starts during menarche. Menarche means this is the first time they get their menstruation. But there is a case in our institution who got pregnant at an early age, at 11 years old.
11 years old.
Yes, and who had not had any menarche, the first time menstruation. She has not had any menstruation yet, and she got pregnant. But in my experience, the youngest I got was 14 years old.
14 years
Yes.
old. Okay. So for as long as the female has had her first menstruation,
Usually, sir.
usually
Yeah,
there is
but
already
there's
a
this
possibility
Isolated case probably that she got pregnant even
without having
having
the first menstruation.
Yeah.
Oh, okay.
Meaning to say
That's
she
interesting.
ovulated, yeah.
So
Meaning
she
to say
ovulated
already,
without
yeah.
the first
Yeah.
menstruation. Okay. Now, is there a special medical care regimen that teenage mothers need to follow, different from those of mature mothers? Or is it basically the same?
Basically, the same prenatal checkups when a patient goes to us, whether teenage or young age or the reproductive age, the same. But we have to emphasize to the teenagers that they have to really follow the regimens that the doctor will tell them. That is to prevent the complications prenatally and during delivery.
But basically, it's just
Yeah,
the same regimen.
yes.
Okay. Nothing really special.
Yes.
Okay.
the same.
Now, what if the female misses her period for the first time? What do you advise a female?
That's the reason why the patient, the teenagers should go to the doctor right away, because if they are sexually active, there's a possibility for them to have been pregnant.
If
So,
they're sexually active?
Yes, if they are, because the moment you miss your period, of course the doctor will suspect that probably she's pregnant. And if they come to your clinic, whether in the presence of the mom or or whether the mom is not there, the fact that they missed their periods when they were previously menstruating, you have to suspect pregnancy, even if they deny any sexual activity.
I see.
Yeah, you have to suspect pregnancy.
So a female that is not sexually active and misses her first period has really nothing to worry about?
Yeah, but most probably they might misinterpret the word sexually active. When I say that is as long as you already have sexual activity, you always suspect that. When we say no, not sexual activity, meaning it is no as in virgin. That's the
Yes.
only time that you don't suspect to be pregnant, and that's another problem.
That's another problem. What could be the possible problems?
Yeah,
if,
there are hormonal problems that the patient does not develop, does not get her menstruation regularly, even if she is not pregnant, especially if you're young, because the brain that controls the hormones is not yet well developed.
Okay.
during
In
teenager.
your practice, Doctora, do you have any sort of special approach when you are assessing or guiding a teenage mother?
Yes, especially if the mom is around and
If
they
the
have
mother
not,
is
yeah,
around.
if the teenager has not told the mom about her pregnancy, I have this room in my clinic, the examination room, that I will have to talk to her about the situation that I'm suspecting that she's pregnant, and then if she agrees to that, and then I just examine her. Sometimes even the mom will go to me and then, Doctora, don't examine her because she's a virgin. So okay, I just close the door and then I proceed to my examination.
I see.
But
So
I
you
don't tell the
insist.
mom right away. Yeah, I don't tell the mom right away. I just instruct the teenager to tell the
Tell the
mom
parents first,
about
and
the
then-
pregnancy later on.
And then come back
Yeah.
for the
But
examination.
I do the pelvic exam.
You do the pelvic exam.
Yes.
I see. Okay. Now, I suppose in pregnancies, in managing pregnancies, the partner also has a role. Okay. What do you think should be the role of the partner? Because, I looked at lines outside OB clinics, and most of the time I see only the females, the mothers there. But I seldom see the fathers, or probably sometimes not even. Okay, so is there really a special role that partners must play during the prenatal care period?
Oh yes, the father or the partner should always. It's better if the partner will go with the wife in the during the prenatal checkup, so that it's such a way that aside from giving her moral support, at least he'll be there to listen to the instruction of the doctor, remind the wife about the instruction of the doctor, and so that the couple will at least, the husband will at least give support to the woman that he's willing to take care of the mom and the future baby.
Okay. Now, going back to the teenager herself. Okay, so assuming the teenager is found to be pregnant, okay, what can we advise mothers, of such teenage mothers also, so that they can have a better quality of life, or maybe a more, shall we say, supportive lifestyle? Because from what I've observed, teenage pregnancies tend to stigmatize or to ostracize very, very young women, because as we all know, in our culture, we're quite embarrassed when we have a child at a very young age who's already pregnant. But I tend to sort of disagree with that, because it does not provide, a healthy environment for the young mother. So what can we tell our mothers or even our fathers about having teenage mothers as children?
Yeah, the parents should support their kids, especially now that they're pregnant, because they need their support, because the teenagers are usually not yet emotionally prepared, and then another thing,
Emotional stability.
They're not yet emotionally developed, and but fortunately for my patients or teenagers, it's always the mom and the father who accompanies them during the prenatal checkup. But it's very important because, as you know, when you're young, you don't understand the implication of getting pregnant at a young age. You're gonna be a mother soon, and you're gonna take care of your baby while you're supposed to be playing outside as a teenager.
As a teenager,
Yeah.
they should be enjoying life.
Yeah.
Okay,
So,
before
the parents should
committing to such
really support them,
responsibilities. I see. So the special role of the parents of the teenage mother is to actually give them the support,
yeah, because
and maybe moral support, even financial support to
most
get through
especially
the pregnancy.
financial.
Most especially financial support. Okay. Now, when it comes to special medical care, are there certain teenage pregnancy complications that require close supervision?
Yes, they're more. To start with, sometimes they are already anemic, so they're the
So
more.
anemia is one
Yeah.
condition.
So that will be worsened by the pregnancy. So they have to take iron preparations the moment they got pregnant during the first trimester, unless they are vomiting, because sometimes we ask them to hold taking the iron if they are vomiting, because the iron usually aggravates the vomiting.
I see. Aside from anemia, are there any other common conditions that teenage
Yeah,
mothers
because-
need to watch out for?
Yes, because most of the teenagers don't eat balanced diet, so in the first place they are not healthy to start with. So now that they're pregnant, they have to take regular balanced diet and more of fruits and vegetables.
More fruits and vegetables,
Yeah.
yes.
Then they have to take vitamin supplements.
Vitamin supplements.
Yes.
Okay. Well, thank you so much, Dr. Furung, for all that information. It's time for our commercial break. You're watching Medical Dilemma. We'll be right back after a few reminders from our sponsors.
Many of our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Imagine it when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Learning gadgets